Hello, in this point, I want us to use the Power BI to come up with the visualizations. And our data is already cleaned, so we are not going to clean it again. In the next project, we are going to use the Power BI to clean so that we can now do the visualizations inside Power BI. Then we go to Excel. We will now give Power BI the priority. Remember, we actually gave Excel the priority. We used Excel to clean. We also went there and started on data modeling. Then we also check on the analysis and the visualizations using the pivot tables. So for the next project, we are actually going to use Power BI to do everything first before we actually shift to Excel just for pivot tables and data insights. So in this part, because we have actually cleaned our data, we are just going to get the data, and our data is actually inside the Excel files. So first of all, you have to click inside the Power BI desktop so that you can actually open it. This is actually the interface, and this is basically the home tab. So you have to get yourself into the data group. Then we have to go get data. You click on it like that, and it always have about 99 data sources. You have to click on Excel workbook because your files are actually in Excel format. Or you just have to click on this Excel workbook. Or you also click on this import data from Excel. So you just have to pick on one. So we can start with this one so that we can go to this one. And finally, we have to use this one here, which is actually Excel workbook. So let's actually start with this one because we actually add up to 4 Excel files. Click on import data from Excel like that. Then on this point, we'll actually have to click on admissions clean, then open like that. And we just have to wait a bit. So please wait as a connection is actually being established. Then you'll actually check a preview. Then it will ask you if you are going to the Power Query or not. So in this point, you can actually check that we have the admissions file, and .xlsx is actually the extension for the Excel files. So you click on the first one there, which is actually the table, and it will actually get you this kind of data. This one too is actually the sheet. So this one is actually in the sheet format, but this one is basically in the table format. So in my case, I will actually pick the table format, then check on the box there. Then in this part, it will actually ask me, are we transforming the data or are we loading it directly? You will actually realize that this data is super clean because we had actually cleaned it by using Excel. So it's basically super clean. So if it was dirty, we had to hit on transform data. So basically we'll check this on the next project. But in my case, because we had already cleaned it by using Excel, I just have to hit on load. So it will be loaded directly into the Power BI. So let's actually wait and see what actually happens. So on this part here, you will actually check the file. So let's actually wait as it is loading or sensing the schema. So loading the data. Yes. Let's be patient a bit. 1200 rows have actually been loaded. So this is it. So this is basically table 1. So we can actually rename it to a different thing. So you can actually click on the table 1 there. Then we just have to rename and call it admissions. There's no problem there. Admissions, just like that. And you click outside, and that's all. So for the next one, we are not actually going to use import data from Excel. No, for the next one, we are actually going to get data. So get data, Excel workbook. Then in this part, the next item will be the patients table. That's the patients file. Then I hit on open. Then let's actually wait as it gets us the options if we are going to get into the Power Query or load directly into the Power BI. So it has to get you the options if you are going to transform the data or load directly. So we have table 1, which is actually this kind of data, and we also have sheet 1. And you'll actually realize that it's actually the same thing, but I want us to use the one which is actually in a table format. So I'll actually check on that. Then I just have to load directly. So it will also be added down here. So let's actually wait as it actually tries to load, and you'll actually check that it has been added there. It's actually table 1. In my case, allow me to actually click on it again, right click, then I have to rename it to patients, just like that, and click outside. So that's all. So we have two tables there. We have the admissions table and we also have the patients table. The next one is also the lab results. So lab results file, I'll hit on Excel workbook directly there. Then lab results. But before we actually get to lab results, we have the treatments file. I'll click on it like that, open. Then it will also get me the options of cleaning or loading it directly. Then we also have to select if it's actually the table or the sheet. So in my case, it's basically the table. So we have actually been importing the ones in table format because they're actually the same, but I would actually want us to stick on table. So tick on table 1 there, then hit on load. So it will be loaded and it will actually appear down there. So 2500 rows loaded. So it will appear down here. Click on it like that, right click. Then in this point here, rename and call it treatments. So treatments, just click outside. So it will be saved. And the last item is actually for the lab results. So for the lab results, we can still get to Excel workbook. Then on this point here, we have to click on lab results file. That's actually our last one. Then open. Then in opening, it will ask us if we are going to Power Query or load it directly. First of all, we have to select table 1. So you pick on table 1. We have actually said that this one in table 1 and the one in sheet 1 are actually the same. So allow me to actually stick with the table. So table 1 checked. Then in this point, because the data is actually clean, we have to load directly. So it will appear down there just after the treatments. So 5,000 rows actually loaded. So this is it. And for table 1, so you can click on it, then you right click, or you can just hit on these 3 dots to the right. Click on the 3 dots to the right. We have rename, then have lab results, just like that, and click outside. So that's all. We have imported our data like that. Yes, you can actually check. Allow me to actually expand for the treatments. You can check that we have the columns when it comes to the treatments. We also have the columns when it comes to the patients table. We have the columns when it comes to the lab results, and we basically have the columns when it comes to the admissions table. So you can actually check that this one is actually for the calendar. So whenever you actually see this icon here, this one is basically telling you that it's a date, and truly it's actually the admission date, and this one is actually the admission ID. Whenever you see this summation, it actually tells you that we add the numerical values inside that column, and it's actually okay because it's actually containing the cost, department, diagnosis. This is basically the date, insurance type, outcome, patient ID, and this one is actually the readmission, the sum of the readmission within the 30 days. That is the total number of patients readmitted within the 30 days. So that's basically okay because it's actually a numerical column. So okay for the admissions table. So let's actually scroll down there to the lab results. So for the lab results, we have the lab date, which is actually okay. It's actually a calendar. Lab ID, patient ID. Then we also have the result. Yes, this one is also a numerical column. That's why we have the summation, the test type. Then finally, then down there, we still have the patients table where we have the age. Yes, we have this summation because age is actually a numerical column. Then the age group, ethnicity, we have this one here because this one is basically the admission. You can actually check that it's the first admission date. Then on this part, we have the gender, we have the patient ID. Here we have the admission ID, doctor, procedure. We have the calendar here because it's actually a date, treatment date. Then finally, we have the treatment ID. So what I can actually do in this point is to show you the data view. So remember, we also added the data view when it came to Power Pivot in Excel. So click on this point here to obtain the table view. So this is basically what you call the data view in Excel. So this is our data. That's when it comes to the admissions table. When it comes to the lab results table, that's actually our data. When it comes to the patients table, that's basically our data. And finally, when it comes to the treatments table, that's basically our data. So that's actually for the table view. And when it comes to the model, this is now where the work begins. So allow me to actually collapse this and also collapse that so that you can actually do the work here. So allow me to also drag that like that, drag this, have this one to be a bit like that, and this one here. In Power BI, the relationships have actually been created for us automatically. This is actually the advantage of using Power BI. It will actually try to identify the common columns in the tables and link them. Like in this point here, we can actually check that this one is actually linking the admission ID. You just have to hover your mouse there to where we have the relationship. So you can actually check that it's the admission IDs. So those two tables, which is actually the admissions table and the treatments table, have actually been linked together based on the admission ID. And it's actually a 1-2. You can actually check 1-2 many relationship. So a 1-to-many relationship was actually created between the admissions table and the treatments table. The advantage of using the Power BI is that the relationships will actually be picked automatically, or it will be detected automatically when it actually finds that there are some common columns in the tables. Now let's also try to understand this one here. So allow me to actually drag it down. Now in this point here, I can actually hover my mouse there and you can actually check that this one here, allow me to actually scroll down there. This one here, this relationship has actually been created based on the common column, which is actually the patient ID. So in the admissions table and inside the patients table, we have a common column, which is actually the patient ID. So this relationship has actually been created based on that common column, which is actually the patient ID. Now, in this case, you will actually understand too that this relationship has actually been created based on the common column, which is actually the patient ID. So there's a common column in the patients table and the lab results table. And that common column has actually made it possible for us to obtain this relationship, which is actually a 1-to-many. That is from the patients to the lab results, 1-to-many relationship. Data modeling was done automatically for us when it comes to the Power BI. We never actually dragged and dropped the way we were actually doing in Excel. So that's it. So that's all about data modeling. I want us to check on the patient demographics and profiles. So we'll actually do the average age by ethnicity to be the first one. So what I'd actually do in this point is to pick on the table here. Then after hitting on the table, this is it. So we have to drag some values into the table. So ethnicity into the columns like that. Then we also drag the age into the same columns there. So in this point, we have the sum of age, but in my case, we would actually want to obtain the average of age. So what we can actually do is to click on this down arrow here. Then on this part, we hit on the average. So this is actually the average of age by ethnicity. Hit on this focus mode so that you can actually check on it clearly. So the average age of patients who are actually coming from the Kalenjin ethnic group is 44.70. The average age of Rambas is actually 45.50. The average age of Kikuyus, that's the Kikuyu patients, is actually 45.24. The average age of the Luya patients is actually 45.20. The average age of the Luo patients is actually 42.57. And the average age of others is actually 43.01. So I would actually want us to split this so that we can also have the impact of gender. To have the impact of the gender, you can actually check that when it comes to the table, we always have the columns only. We do not have a point where we have the rows. So allow me to actually remove that, remove this. So I will also click on the matrix. So let me first actually remove this table here so that we can pick on the matrix. Click on the matrix. And now this is it. So the difference between the table and the matrix is that the matrix actually has the rows. You can actually check that. I do have the rows here. But in the tables, we actually had the columns only. Now in this part, we are actually dragging the ethnicity into the rows like that. So we have Kalenjins, Kambas, Kikuyus, Luyas, Luos, and others. So in this part here for the columns, I would actually want us to drag the gender into the columns there. Then you can actually check that you have the females and the males. So the next thing is to actually drag the age into the values. And now it will be the average of age and not the sum of age. Just like that. And that's all. Hit on the focus mode so that you can now check on it clearly. So in this part, you can actually check that the average age of the female Kalenjin patient is actually 46.23. The average age of the female Kamba patients is actually 46.05. The average age of the female Kikuyu patients is actually 44.86 years. The average age of the female Luya patients is actually 46.21 years. The average age of the female Luo patients is actually 41.60. And finally, the average age of the other females is actually 42.43. And the average age of the female patients generally in the hospital is actually 44.46 years. For the males, the average age of the male Kalenjin is actually 43.07. The average age of the male campus is actually 45.08 years. The average age of the male Kikuyus is actually 45.80. The average age of the male Luyas is actually 43.98. The average age of the male Luos is actually 43.98. The average age of the other males is actually equivalent to 43.62. And generally, the average age of the male patients in the hospital is actually 44.22. That's it when it comes to analyzing the average age by ethnic group and also by ethnic group and the gender. Now, I would also want us to check on analyzing the patient attendance by age group and gender distribution. So allow me to actually click on the three dots and remove. So I would actually want us to analyze the patient's attendance by age group and by gender distribution. So what we are actually going to do in this point, we can click on the matrix. So after clicking on the matrix, allow me to actually bring it down here. So we will actually drag the age group into the rows like that. Then because we are actually focusing on the attendance, that's actually, we'll actually be focusing on the admission. So attendance is actually the admission. So in this point, we'll actually drag the admission ID into the values. So you drag the admission ID down there into the values, just like that. And now we'll actually click on this down arrow so that you can actually do the count of admission IDs. So that's it. Hit on the focus mode. And now you can actually check that in this part here, for the age group, the total number of adult patients who actually attended the top care hospital is actually 577. The total number of child patients is actually equivalent to 100. The total number of senior patients is actually equivalent to 230. And the total number of young adults in the hospital, that's the total number of young adult patients in the hospital, is actually 293. So you can always click on these three dots here so that you can always sort. So you can sort based on the count of admission ID. So you can click on the count of admission ID. Then you come to this point here and sort in a descending order or ascending order. In my case, you can actually check that the descending order has actually been checked. So you can actually check that it's from the descending order, from the largest, which is actually 577, to the smallest, which is actually 100. Remember, you can always click on this down arrow too so that it can actually allow you to sort. If I click on it like that, you can actually check that it is in an ascending order from the smallest all the way to the largest. But if I click on it again, it will be from the largest all the way to the smallest. So basically, that's how you can actually check on the patient attendance by age group. So that's it. So the attendance in our case is actually registered by the admission ID. I would also want us to check on the patient attendance by gender. So what we are actually going to do in this point is to go up there and you can actually check that for the age group, we'll actually remove the age group and just drag in the gender. So click on that X and drag in the gender. So gender into the rows, just like that. So hit on the focus mode, and now you can actually check that the total number of female patients who actually attended the hospital were actually equivalent to 616, and the total number of male patients who attended the hospital was actually 584. So clearly you can check that in the top care hospital, we have most of the patients being females. So that's it. But remember, you can actually combine the age group and the gender in one visualization to drag the age group into the rows like that. Then you actually drag the gender into the columns, just like that. Now in the values there, we will be having the count of the admission IDs, which is actually the attendance in our case. So, or the count of the patients. So we can actually check that when it comes to the age group, we have adult, young adult, senior, child. In this point, we also have the gender, females and the males. So the total number of female adults in the hospital is actually equivalent to 282, and the total number of male adults in the hospital is actually 292. The two actually sum up all the way to 577. The total number of female young adults in the hospital is actually 163, and the total number of male young adults in the hospital is actually 130. And the two actually sum up to 293. In this part here, the total number of female senior patients in the hospital is actually 111. And in this case too, the total number of male senior patients in the hospital is actually 119. And the two actually sum up to 230. On this part too, the total number of female child patients in the hospital is actually 57, and the total number of male child patients in the hospital is actually equivalent to 43, and the total actually sum up to 100. So we can actually check that the hospital is actually dominated by the adult patients who actually take 577 to be the total. And the hospital is also dominated by the female patients, because you can actually check that their total is actually 616, while the total for the male patients is actually equivalent to 584. So that's all about the patient demographics and profiles. I want us to check on the admission trends and volume analysis. So we'll actually start by analyzing the admissions by departments. So let's actually try to check on the admissions by departments, so that you can actually check the department which actually admits the highest number of patients, and the department which is actually admitting the least number of patients. So this one will actually help us when it comes to recruiting the new doctors, because we will always try to get the doctors who will always be going into the departments which are actually congested, not the ones which are actually less congested. So in this point, allow me to actually hit on the matrix. So we are going to obtain the admissions by departments. So what you actually do in this point is to drag the department into the rows like that. So you can now check that I have my departments, around 7 of them, from cardiology all the way to surgery. Now I would actually want us to count the number of patients who have actually attended these departments. So to count the number of patients, we actually have to use the admission IDs. So we actually drag the admission IDs into the values. So drag the admission ID into the values, so that we can actually obtain the count of the admission IDs. So click on the down arrow there, then you actually hit on count, just like that, and I hit on the focus mode. So clearly you can check that for the cardiology department, the total number of patients who actually attended the department was actually equivalent to 178. We have 185 patients attending the emergency department, 163 patients attending the general medicine department, 158 patients attending the obstetrics department, 180 patients attending the orthopedics department, 172 patients attending the pediatrics department, and finally 164 patients attending the surgery department. So when it comes to sorting this, you can actually click on this down arrow. You can click on the down arrow, and it will actually sort in a descending order, which is actually from the largest 185 to the least 158. You can also come to this point here, click on the 3 dots there. Then we have what you call sort by. So we'll actually be sorting based on the count of the admission IDs. So it has actually been checked, count of admission IDs. Then sorting in which order. In this point, you can actually check that sorting in a descending order has actually been checked. So 185 all the way to 158. So if you would like to have this 158 on top and 185 at the bottom, what you have to do is to actually hit on ascending order, 158 all the way to 185. Or you can just click on this up arrow and down arrow, so that you can actually do all that work. So if the hospital actually wanted to recruit 2 doctors, as an analyst, I would actually advise the hospital to actually recruit a doctor for the emergency department and for the orthopedics department, because those ones actually register the highest number of patients. 185 patients for the emergency department, 180 patients for the orthopedics department. That's all about the admissions by departments. Allow me also to check on the diagnosis by frequency. So allow me to click on these 3 dots, then we hit on remove. So let's also hit on the matrix there. So I can actually pull it to this point here. So diagnosis by frequency, that's actually the analysis. We would actually want to identify the number of people who are actually treated of anemia, fractures, gastritis, pneumonia, UTIs, the number of patients treated of those diseases. So how will we actually obtain the count for the number of those patients? So first of all, we have to drag the diagnosis into the rows. So we have the diseases here. So how will we actually obtain the count for these diseases? So to obtain the count, drag the admission ID into the values. So double click on the admission ID, drag into the values. So this is basically the first admission ID, but in my case, I would actually want to obtain the count. Click on the down arrow there, hit on the count. So that's it. Now hit on the focus mode. So this is basically what you call diagnosis by frequency. So for anemia, the total number of patients who were actually treated were actually 113. For appendicitis, total number of admitted patients 113. Arthritis, the total number of admitted patients 108. COVID-19, total number of patients 104. Diabetes mellitus, total number of patients is actually 105. Fractures, total number of patients is actually 82. Gastritis, the total number of patients is actually 84. Heart failure, the total number of patients is actually 106. Hypertension, the total number of patients is actually 107. Malaria, the total number of patients is actually 80. Pneumonia, the total number of patients is actually 96. And finally, for the UTI, the total number of patients is actually 102. And the total count for the patients is actually 1200. So in this point here, if a specialist doctor was supposed to be hired or recruited in this hospital, then I would actually advise the hospital to bring the doctor who actually cures anemia and appendicitis. So allow me to actually click on the sorting arrow there so that you can actually obtain in a descending order. So you can actually check that anemia and appendicitis are the most common diseases. So let's also check on the diseases which have the highest readmission risk. So that's it. So allow me to click on these three dots there, hit on remove. So for the diseases which have the highest readmission risk, I will have to click on the matrix. After clicking on the matrix there, I'll actually bring the matrix to this point. Then for the diseases, it's actually inside the diagnosis column. So you drag the diagnosis column into the rows like that. Then what you also have to do is to drag the readmission into the values. So that's it. So allow me to actually expand this to the left, and I can just hit on the focus mode there. So you can actually check that for anemia, the total number of patients who were actually readmitted within the 30 days is actually equivalent to 16. For appendicitis, the total number of patients readmitted within the 30 days is actually 12. For arthritis, the total number of patients readmitted within 30 days is actually 12. For COVID-19, the total number of patients readmitted within 30 days is actually 9. For diabetes mellitus, the total number of patients readmitted within 30 days is actually 20. For fractures, the total number of patients readmitted within 30 days is actually 14. For gastritis, the total number of patients readmitted within 30 days is actually 10. Heart failure, the total number of patients readmitted within 30 days is actually 13. For hypertension, the total number of patients readmitted within 30 days is actually equivalent to 15. For malaria, the total number of patients readmitted within 30 days is actually equivalent to 7. For pneumonia, the total number of patients readmitted within 30 days is actually equivalent to 9. And finally, for the UTIs, the total number of patients readmitted within 30 days is actually equivalent to 6. In this hospital, the total number of patients who have actually been readmitted is actually equivalent to 142. So you can actually click on this down arrow so that you can actually sort from the largest to the smallest, and you can also click on it so that you can sort from the smallest to the largest, but allow me to actually stick from the largest to the smallest. The total number of patients who have actually been readmitted when it comes to diabetes mellitus is actually equivalent to 20. That actually means that we have to improve the treatment of diabetes mellitus because a lot of patients are actually being readmitted within 30 days. A total of 20, that's actually too high. The hospital can actually improve two items. One, it can actually hire more qualified doctors to treat diabetes mellitus, or it can also buy more advanced equipment when it comes to treatment of diabetes mellitus. For the UTI, you can actually check that the doctors here are actually doing some good job because it has the least number of readmitted patients actually at 6. So that's it. So whenever the patients are actually released, the patients who are actually admitted of diabetes mellitus are the ones who have the highest risk of being readmitted, because you can actually check that the trend here is not actually fair for them. So patients suffering from diabetes mellitus have the highest risk of being readmitted. So that's all. Now I would also want us to check on the last item, which is which age groups have the highest readmission risk. So what we actually do for the age groups, we just drag out the diagnosis and drag in the age group. The age group is actually inside the patient's table. So just like that, and you can actually check that the total number is actually still 143. That's the total number of readmitted patients, 143. So the total number of adults who are actually readmitted is 71. The total number of young adults who are actually readmitted within the 30 days is actually equivalent to 41. The total number of senior adults who are actually readmitted within the 30 days is actually equivalent to 22. And finally, the total number of child patients who were readmitted within the 30 days is actually equivalent to 9. So clearly you can check that the adults have the highest risk of being readmitted because they top the list with 71. I want us to check on the cost and financial analysis. So in the cost and financial analysis, we'll actually be starting with the revenue by department. So revenue by department, we'll actually use a matrix. So we'll actually be using a matrix for most of our cases. So you drag the departments. Departments is actually inside the admission step up there. So you drag the department into the rows like that. Now you can actually check that we have about 7 departments, and we would also want to obtain their revenue. So the revenue is actually inside the cost. So we have to drag that cost into the values. Just like that, and that's all. So we have the sum of revenue by department. So allow me to actually hit on the focus mode. So this is basically what you have. I'll also hit on that down arrow, hit on it again so that you can actually sort from the largest to the smallest or the smallest to the largest. In my case, I'll actually stick with this one here, which is actually from the largest to the smallest. So for the orthopedics, we have 83, 809, 10. That is 8,380,910. So this one is actually giving us the highest revenue, the orthopedics. And on this case too, for the emergency department, you can actually check that we have 8,024,154. When it comes to cardiology, we have 7,998,381. Pediatrics 796,7901. Obstetrics 758,5974. Surgery 755,1011. General medicine 6,901,701. So if the hospital actually has to make a lot of revenue, I would actually suggest that we have to improve these departments here, which is actually the surgery and general medicine. So let's also check on the average cost of treating the diseases. So I'll actually click on the 3 dots there, then hit on remove. So for the average cost of treating the diseases, I'll actually click on the matrix there, then drag it to this point. So we will have to drag the diagnosis into the rows. So drag the diseases, which is actually inside the diagnosis column, into the rows. Then what you have to do next is to drag the cost into the values. So drag the cost into the values. Now, in this point here, you will actually realize that we will be obtaining the sum of cost. So in this part here, we have anemia. So for all the patients who are actually suffering from anemia, the total cost collected from them is actually equivalent to 449.6576. For all the patients who are actually suffering from appendicitis, the total amount collected from them is actually 47,33,712. For all the patients who are actually suffering from arthritis, the total amount collected from them is actually 47,28,665. For all the patients who are actually suffering from COVID-19, the total amount collected from them is actually 46,211.99. For all the patients who are actually suffering from diabetes mellitus, the total amount collected from them is actually 49,56,050. How about the average of cost? That is the total cost divided by the number of patients, so that you can actually identify the average cost of treating each disease or the average cost of diagnosis. So what you have to do in this point is to click on this down arrow here, then we go to average. So that's all. Now you can actually check that in this part here, the average cost of treating anemia is actually 39,792.71, while the average cost of treating UTI is actually equivalent to 47,150.99. So that's all. I can actually hit on the down arrow there. Now we can actually conclude that the most expensive disease to treat in this hospital is actually fracture. So fracture is actually the most expensive disease to treat in this hospital because it has the highest average of cost, which is actually equivalent to 51,134.43. While anemia is actually the cheapest disease to treat in this hospital because it has the least average of cost being 39792.71. So we can actually say the top 5 expensive diagnoses to treat in this hospital is actually equivalent to fracture, malaria, gastritis, diabetes, UTI. So I want us to also check on the revenue by insurance type. Total amount collected from NHIF, the total amount that was actually collected by cash, the total amount that was actually collected as cash, the total amount that was actually collected by NHIF, the total amount that was actually collected by the private insurance, and others. So we have different insurance types, and I would actually want us to check on the distribution of revenues by those insurance types. So very simple. So allow me to actually click on the 3 dots there so that you can actually remove that. And in this part, we'll actually click on the matrix there. After clicking on the matrix, I'll actually drag it to this point. So in this case, we'll actually drag the insurance type into the rows. After dragging the insurance type into the rows, we'll have the cost 2 into the values. So drag the cost into the values like that. And that's all. So we have the sum of cost, which is actually the sum of revenue in our case, by the insurance types. The total amount received as cash is actually equivalent to 1,347,342 Kenya shillings. The total amount received by NHIF is actually equivalent to 2534,2337. So NHIF is actually the insurance given by the government, which is actually the National Health Insurance Fund. So I can actually hit on the down arrow so that we can arrange in a descending order. So we can actually conclude that majority of the revenue in the hospital was actually received through the NHIF, because we have a total amount equivalent to 25,342,337 Kenya shillings, followed by the private insurance, which is actually equivalent to 14,107,721, and the list was actually from others, and it's actually equivalent to 4,612,632. So majority of the revenue in this hospital is actually received through the NHIF. I would actually want us to check on clinical outcomes and quality of care. So we will actually start with obtaining different outcomes by departments. So if we actually obtain the different outcomes by departments, remember that our outcomes are actually transferred, improved, persist. So if we can actually obtain the different outcomes by departments, then it can actually mean we are going to identify the department which has the highest mortality rate, the department which has the highest number of patients discharged, the department which has the highest number of patients who have actually improved, such kinds. So for us to actually obtain the outcomes by departments, so click on the matrix like that, then drag that matrix to this point. So what you have to do is to drag the department into the rows. After dragging the department into the rows, what you have to do next is to drag the outcome into the values, so that you can actually obtain the count of outcomes. Remember, in the outcomes you have deceased, we have improved, transferred, such kinds. So we'll be actually doing the count for the deceased, count for the improved, count for the transferred, such kinds. So hit on this down arrow here and hit on count, just like that, and allow me to hit on the focus mode. So in this case, you can actually check that we have in the cardiology department, the total number of outcomes is actually 178. So this one does not actually tell us the real picture, because what we actually wanted in this point is not just the count of outcome by department, but I wanted us to break down this outcome so that we can be having deceased, the number of deceased when it comes to cardiology department, the number of those who have actually transferred when it comes to cardiology department, and the number of those who have actually improved. So it's actually very possible for us to come up with such kind of a picture so that we can actually understand the mortality rate and what's actually happening in all the departments. So what you have to do in this point is to drag the same outcome into the columns. After dragging the same outcome into the columns, now you can actually check that we have deceased, discharged, improved, transferred. So in the cardiology department, the total number of deceased persons is actually equivalent to 3. And the total number of persons who were actually discharged in the cardiology department is 144. The total number of patients who were actually improved in the cardiology department is 24. The total number of patients who were actually transferred is 7. And now the total number of outcomes in the cardiology department is actually equivalent to 178. For the general medicine, we can actually check that the mortality rate is actually low, because you can actually check that the deceased persons is actually 1. So we have 1 deceased person in the general medicine, and we also have 1 deceased person when it comes to the surgery department. So it actually means that the mortality rate is actually low when it comes to the general medicine department and also the surgery department. The mortality rate is actually very high when it comes to the emergency department because it's actually leading with the highest number of deceased persons being 9. When it comes to the discharged column, we can actually check that the cardiology department has the highest number of discharged patients. And when it comes to the improved column, we can actually check that this one here, which is actually that 7, the orthopedics department has the highest number of patients who actually improved. And finally, in the transferred column, we have these two items here, which is actually the general medicine department and the obstetrics department having the highest number of patients who are actually transferred. So that's all. So you can actually do some advice when it comes to the general medicine and obstetrics department so that we can actually try to improve the health. Yeah, either we actually look for the quality doctors or we buy quality equipments so that we can't actually be transferring a lot of patients to other hospitals to go and seek for quality healthcare. Let's actually focus on the treatment analysis. So when it comes to the treatment analysis, I would actually want us to check on the doctor's overload. So are there some doctors who are actually doing a lot of work and should actually be relieved? And are there some doctors who should actually be added some task? So let's actually check that. So I'll actually click on the matrix there. Then I'll actually drag it to this point here. That's to the bottom right. Then on this point here, I'll actually drag the doctor into the rows. After dragging the doctor into the rows, we will also have to drag the count of admission IDs. So we'll actually be checking the number of patients attended by Akenye, the number of patients attended by Chebet, number of patients attended by Kamau, all the way to Dr. Wanjiku. So count of admission ID, drag the admission IDs into the values and now change the first to count. So click on the down arrow there, then you actually hit on the count, then hit on the focus mode. So basically you can actually check that Dr. Akenye has actually admitted 394 patients. Dr. Chebet has actually attended 356 patients. Dr. Kamau has attended 363 patients. Dr. Mutua has actually attended 354 patients. Dr. Mwangi has attended 320 patients. Dr. Umondi attended 364 patients. Dr. Wanjiku has actually attended 349 patients. So clearly in this point, you can actually check that Dr. Akenye is the one attending a lot of patients. The highest number here is actually 394. And Dr. Mwangi is actually attending the least number of patients, 320. So we can actually try and balance the work for Dr. Akenye so that we can add some work to Dr. Mwangi to at least 350. That actually means that we will be reducing the work overload for Dr. Akenye from 394 also to around 360, which is actually almost the average. So basically that's how you can check on the doctor's overload so that you can reassign some doctors who are actually having the least task, some task, and also relieve the doctors who are actually having the highest workloads. On this point too, I would actually want us to have the count of procedures by diagnosis. So for the count of procedures by diagnosis, we'll actually remove the doctor from the rows and we'll also remove the count of admission IDs from the values. So count of procedures by diagnosis. So we'll drag the diagnosis into the rows. Drag the diagnosis first into the rows before we actually continue. Diagnosis into the rows like that. So we have from anemia all the way to UTI. So we have different kinds of procedures like physiotherapy, surgery, therapy. We also have blood transfusion. So when it comes to anemia, how many cases of blood transfusion have we had? How many cases of surgery have we had? How many cases of physiotherapy have we actually had? So I would actually want us to have that one up there in the columns. So what you have to do is to drag the procedures into the columns. The procedures are actually down here. So drag the procedures into the columns, just like that. So we have the blood transfusion, dialysis, for therapy, lab test, medication, physiotherapy, surgery, all the way like that. You can actually use this scroll bar down here. So we have surgery, ultrasound, and x-ray. So all those are the kinds of procedures that you actually have when it comes to all these diseases. So I would actually want now to obtain the count of these procedures inside this diagnosis or inside these diseases. So how many cases of blood transfusion did we actually have when it comes to anemia? How about when it comes to appendicitis? How about arthritis? How about when it comes to COVID-19? So it's actually very possible for us to obtain the count of procedures. So we have to drag that procedures into the values, but now we'll be obtaining the count. So count, hit on the count there, and that's it. So when it comes to anemia, we have 23 cases of blood transfusion. When it comes to appendicitis, we have 21 cases of blood transfusion. When it comes to arthritis, we have 27 cases of blood transfusion. When it comes to COVID-19, 28 cases of blood transfusion. When it comes to fracture, we have 21 cases of lab test. When it comes to malaria, we have 13 cases of medication. When it comes to appendicitis, we have 20 cases of surgery. So let's now do a proper analysis here. So in this point, we'll actually say that the most common procedure when it actually comes to anemia is therapy. Yes, we can actually say therapy because it has 30 cases. Now, when it comes to COVID-19, this one here, so for COVID-19, we have all the way from 28, then we also have 27. So we can actually check that 28 is actually the highest number. So in COVID-19, the most common procedure is actually blood transfusion. We can also come to this point here for gastritis. So in gastritis, we have from 25, that is in blood transfusion, all the way to 22. So clearly you can check that 25 is actually the highest value here. So we can actually say that in gastritis, the most common procedure is actually blood transfusion. And finally, when it comes to UTI, we have that 6 from blood transfusion all the way up to 20 when it comes to X-ray. So we can actually say that in UTI, the most common procedure is actually blood transfusion. So we can actually make the comparisons here. So from 303 cases for blood transfusion to 283 cases when it comes to the X-ray. So you can actually check that we also do have 319 here. So the most common procedure generally in the hospital is actually the lab test because it has 319 cases, followed closely by blood transfusion, which is actually having 303 cases. One of the least common procedures in the hospital is actually this one here, that is surgery, because it has 243 cases. I want us to check on the laboratory analysis and clinical insights. So I want us to check on the average result for every test type. So we have the test types and we have the results, and I want us to obtain the average result for these test types. For the test types, we have the food therapy, we have the blood glucose and such kinds. So I want us to get the average result. So I'll actually click on the matrix. Then after clicking on the matrix, I'll actually drag it to this point here. Then I'll drag the test type into the rows and drag the result into the values. Just like that. And I'll actually click on the down arrow there and select average. That's all. Now hit on the focus mode. So the average result when it comes to the blood glucose test is actually equivalent to 47.98. The average result when it comes to cholesterol test is actually 51.47. The average result when it comes to creatinine test is actually 51.14. The average test when it comes to CRP test is actually equivalent to 50.75. The average test when it comes to hemoglobin test is actually 51.25. The average test when it comes to malaria test is 49.84. When it comes to platelets test, the average result is actually 48.89. The average result when it comes to potassium test is 50.61. The average test result when it actually comes to sodium test is 50.93. And the average result when it comes to white blood cells test is 50.25. Now, if you would actually want to break down this average of results by different ethnicities so that you can actually check if there is a crisis when it comes to a certain ethnic group, what you have to do is to drag the ethnicity into the columns. So drag the ethnicity into the columns there and you will have a breakdown. So the average result when it comes to the blood glucose for the Kalenjin ethnic group is actually 43.26. The average result when it comes to hemoglobin test for the Kikuyus is 47.99. The average result when it comes to potassium test for the Luo ethnic group is 54.83. The average test when it comes to malaria test for the Kikuyu ethnic group is actually 47.63. And the average result when it comes to the white blood cells test for the Kalenjin ethnic group is actually 54.56. So that's basically how you can break down the average of results by different ethnic groups. You can also break down the test types and the average of results based on the gender. Remember, this is actually for both females and males, the total average actually. So you can always drag the gender again. That's the gender is actually inside the patient's table. So you can drag the gender into the columns there. And now you can actually check that when it comes to the blood glucose test, the average result for the females is actually 48.53. When it comes to the hemoglobin test, the average result when it comes to the males is actually equivalent to 51.74. The average result when it comes to the sodium test for the females is actually 50.07. And finally, I can actually say that the average result when it comes to the white blood cells test for the males is actually equivalent to 49.25. So that's all. And now you can actually check that the average now for the females generally in the hospital is 50.54, and average result for the males in the hospital is actually 50.07. So you can actually check that they are actually the same. So the total average now is actually equivalent to 50.32. So let's also check on the breakdown of test types by age groups. So it's actually very possible. So we'll actually drag the age group into the rows like that. Now we have the age groups. Yes. So up there, we should actually be having the test types. So what you actually do is to get the test type into the columns. Yes, the test types from the lab results. So we have that. Now we have to get ourselves the count of these test types inside these age groups. So to obtain the count of test types, we have to drag the test type into the values so that we can now click on the down arrow there and hit on count. That's all. So when it comes to blood glucose, majority of the patients who actually go for the test are the adults, and they are actually equivalent to 210. When it comes to cholesterol test, majority of the patients who actually go for the test are the adults again. When it comes to creatinine test, majority of the patients who also go for the test are the adults. When it comes to CRP test, it's also the adults with 235. When it comes to hemoglobin, majority of the patients who actually go for the test are the adults. When it comes to malaria, majority of the test is actually done by the adults, and it's actually 239 adults. When it comes to platelets test, majority of the patients who actually go for the test are the adults, 243 of them. When it comes to potassium test, majority of the test is actually done by the adults, 238 adults. When it comes to sodium test, majority of the test is actually done by the adults, 258. And finally, when it comes to the white blood cells test, majority of the test is actually done by the adults, and it's actually 214. So it actually means that the test types is actually led by the adults, and you can actually check that we have 2293 tests done by the adults, followed by young adults who actually do a total of 1275 tests. So you can actually check that the range is too big, it's almost twice. And the least number of tests is actually done by the children with 415 tests. So that's all when it actually comes to the lab analysis and clinical insights. This is actually a cross analysis, and I would want us to check on the spread of different diseases across the different quarters or across the different years. So that one is actually very possible. That one in Excel will actually be too tedious, and in this case it's actually a game of a button click. So allow me to actually click on the matrix there. So I'll drag the matrix to this point. Then I would actually want us to check on the spread of these diseases across the different times of the year. So what we are going to do is to drag the admission date into the rows. What we are going to do next, because we now have 2024 and 2025, what we are going to do next is to drag the diagnosis into the columns. Now you can actually check that I have my diseases on the columns, but now when it comes to the values, we will drag the count of the diagnosis into the values. Just like that, click on this down arrow here, then hit on count. It's actually done. So what you can actually do in this part is to hit on this plus so that you can actually break it down, hit on this plus again to actually break it down. In 2024 quarter 1, we had 11 cases of anemia. In 2024 quarter 2, we had 12 cases of anemia. In 2024 quarter 3, we had 17 cases of anemia. And in 2024 quarter 4, we actually had 19 cases of anemia. So we can actually check that in this point here, anemia is actually highest on quarter 4, and it's also the highest on quarter 4 here. So we can actually say that when it comes to quarter 4, there is actually a high risk of anemia. When it comes to appendicitis, you can actually check that we have 10 cases in quarter 1, 10 cases in quarter 2, 12 cases in quarter 3, and 17 cases in quarter 4. In this point, we can actually check that we have in quarter 1, 13 cases, quarter 2, 20 cases, quarter 3, 13 cases, quarter 4, 18 cases, and you can actually check that it's actually evenly spread. So that's all. So I would also want us to check if a certain ethnic group is actually prone to certain diseases. So we have to drag the diagnosis into the rows like that. Then we basically drag the other item apart from the diagnosis. We have to drag the ethnicity into the columns there. Then now we have to obtain the count of this diagnosis. So for the count of diagnosis, you have to drag the diagnosis into the values. So get up there and drag the diagnosis into the values. Click on this down arrow here. Then we actually hit on the count. So you can actually check that anemia is actually a rampant diagnosis when it actually comes to the Kalenjin ethnic group. We can't actually say it's actually rampant here because this other is actually a combination of several ethnic groups, about 30 of them. So 30 ethnic groups sharing that one will actually be so small. So we can confidently say that anemia is actually very common when it comes to the Kalenjin ethnic group. When it comes to the appendicitis, we can confidently say that it's actually very common when it comes to the Luos. And for the arthritis, very common when it actually comes to the Kampas. For the COVID-19, it's actually very common when it comes to the Kikuyus. For the diabetes mellitus, it's actually a rampant disease when it actually comes to the Luos. For the fractures, it's actually very common when it comes to the Kalenjins. For the gastritis, it's very common amongst the Kalenjins. For the heart failure, it's very common amongst the Luos. Yes, the Luos and actually the Kalenjins, because it's actually 25 and 24. For the hypertension, it's actually very common or rampant among the Kampas. For the malaria disease, it's actually very common amongst the Kampas and the Kalenjins. And for the pneumonia, it's actually very common amongst the Kalenjins and the Kampas. And lastly, for the UTI, it's actually very rampant when it comes to the Luyas and the Kikuyus. Yes, closely followed by the Kalenjins. So that's actually the breakdown of the different diagnoses by the ethnic groups. I would also want us to have the breakdown of the outcomes by the insurance type, so that we can actually try to establish if there is an impact of the insurance type on the outcome. So we will actually have the insurance type. Look for the insurance type. It's actually here. Drag it into the rows like that. Then for the columns, what you have to do is to drag the outcome. So have the outcome on the columns like that. Then we actually have to get ourselves the count for the deceased. How many patients were actually paying by cash? For the ones who were actually discharged, how many of them actually paid by cash? For those who actually improved, how many paid by cash? And finally, for those who were actually transferred, how many paid by cash? The same applies to NHIF, other, and private insurance. So we have to get ourselves the count of the insurance type. So in this point here, we'll actually go down into the values so that you can actually drag the count of insurance type inside the values. So insurance type into the values, then click on the down arrow, then hit on the count. So count of insurance type. Out of the 25 persons who were actually deceased, 4 of them had actually paid by cash. And out of the 900 patients who were actually discharged, 180 of them actually paid by cash. Out of the 207 patients who actually improved, that 4 of them actually paid by cash. And finally, out of the 68 patients who actually got transferred to another healthcare facility, 13 of them actually paid by cash. So the total number of those who actually paid by cash is actually equivalent to 231 patients. And for the NHIF, out of the 25 patients who actually passed away, 14 of them had actually paid by NHIF, and out of the 900 of them who actually got discharged, 4 or 6 of them actually paid by NHIF, out of the 207 patients in the hospital who actually improved, 99 of them actually paid by NHIF. And finally, out of the 68 patients in the hospital who actually got transferred to a better healthcare facility, 34 of them actually paid by NHIF. Clearly, you can check that NHIF, even though it's actually having the highest number of patients who actually passed away, then you can actually check that it's actually doing good, given that it has the highest number. Yes, it has 500 plus. This one is actually close to 600. It's actually 553. So it's actually doing fairly good. I want us to check on the readmission risk analysis. So when it comes to readmission risk analysis, it actually means that we first have to obtain the number of patients who are actually readmitted. Now, we have the total number of admissions. Yes, we can actually obtain the total number of admissions by obtaining the count of admission ID. So if we obtain the total number of admissions by using the admission ID, then it actually means that some patients who had actually come to this hospital, so we'll actually go into the admissions table, and inside the admissions table, we'll actually obtain the total number of admissions, and to obtain the total number of admissions, we'll actually check the count of patient IDs. So to obtain the total number of admissions, you can actually use the count of patient IDs or the count of admission ID. But in this case, allow me to actually stick with the patient ID. So if we obtain the count of patient ID inside the admissions table, then it will actually tell us the number of admissions. But remember one thing, there are some patients who have actually been readmitted. So that count of patient ID will actually get you the number of patients who have been admitted for the first time and the number of patients who are actually being readmitted. So it's actually a total. What will we actually use so that we can obtain the number of patients who are being admitted for the first time? So to check on the number of patients who are being admitted for the first time, we have to use distinct count. Yes, in distinct count of the patient ID, it will actually show you the patient IDs which have not been repeated, telling you that this patient had not been admitted before. Let's check what I'm actually saying. So in this point, we'll actually use a card. I'll click on a card. Then after clicking on a card, I want us to obtain the total number of admissions. So for the total number of admissions, we can basically use the count of patient ID or the count of admissions ID. That's actually inside the admissions table. Make sure that. So it's actually inside the admissions table. We would like to check the total number of admissions. So the total number of admissions, you go into the admissions table and you drag the patient ID into the field, or you drag the admission ID into the field. Then click on this down arrow here. Then you hit on count. So this is basically the count of admissions. It's actually the same thing as using the admission IDs. I can actually click the card there. Then after clicking on a card, I can drag the admission IDs into the field. So admission ID into the field, and click on that down arrow, hit on count. So basically it will get you the count of admissions. So these ones are basically the admissions. Now, some patients were actually admitted for the first time and some were actually being readmitted. For the patients who are actually being admitted for the first time, how will we actually obtain the count? So let's obtain the count of the patients admitted for the first time. So the count of patients admitted for the first time, will also use a card. So drag it to this point here and I'll actually enlarge it. So the count of patients admitted for the first time, then we will basically use the patient ID. And what will we actually do? We will use the distinct count inside the patient ID. Distinct count will always get you the IDs which are not repeated, telling you that this patient had not been admitted before. So this is a patient being admitted for the first time. So let's check on the number of patients being admitted for the very first time. So we have to drag that patient ID into the fields like that, then hit on this down arrow here. Then we have count distinct. Click on it. So the number of patients being admitted for the very first time is actually equivalent to 614. And remember, the total number of admissions was 1200. So this actually tells you that we have to say 1200 minus 614 so that we can actually get the total number of readmitted patients. So we can actually remove this one here for the admissions so that we can stick with this for the patient ID. So total number of admitted patients, total number of patients being admitted for the very first time. Now, how will we actually obtain the total number of readmissions? Because yes, it's actually 1200 minus 614. But how will we actually obtain by using the DAX measures? But how will we actually obtain in this case here without actually doing the subtraction outside this visualization? So I want us to introduce what we actually call a DAX measure. So in introducing a DAX measure, what we actually have to do is to get ourselves into the admissions table there, right click on it, then we have what you call the new measure. You have to click on it, or you just have to get yourself into the admissions table there, click on these three dots, then we also have what you call the new measure. Just like that, hit on the new measure there, then we will actually say the number of readmitted patients. So backspace there, number of readmitted patients. So number of readmitted patients, space, equivalent sign, space. So the number of readmitted patients is actually equivalent to the total admissions minus the number of patients being admitted for the very first time. You must understand that logic before we actually go into using the formulas. So to obtain the total number of admissions, we actually use count of patient IDs. We have to use count, just like in Excel. So count, then we actually open. Then in this point, the patient IDs is actually inside the admissions table. So this is basically the admissions table. Scroll down so that you can actually get the column for the patient IDs. So this is the column for the patient IDs inside the admissions table. Click on it once like that, then you actually close. So count the number of admissions, which is actually the patient IDs inside the admissions table. So it will actually count all of them, including the repeated ones. Space minus space. Now we would want to exempt the number of patients who are being admitted for the very first time. So we actually use distinct count. So in that point, we actually type distinct like that, and you will actually see distinct count. Click on it once like that, then come to this point again. That's the admissions table. Scroll down so that you can actually pick on the patient ID. Click on it once like that, then you close the distinct count function. So this one will actually get you the total number of admissions in the hospital. That's the count function. But this one here will actually get you the total number of patients who are actually being admitted for the very first time. Hit enter on the keyboard and you will actually get a new measure there inside the admissions table. So let's actually wait and see. So you can actually check that we have the new measure there, which is actually the number of readmitted patients. So remember, we have not actually done anything new. In this point, we were actually using the count. I click on it. Now you can actually check that it's actually the count, and it's the same count that you have actually used there. In this point here, we were actually using the count distinct. So if I actually click on this down arrow here, you'll actually check that we used count distinct. That's the same count distinct which we have actually used when it comes to this part here to obtain the number of patients admitted for the very first time. Now I want us to drag a visualization or a card just like that into this part here so that we can drag the number of readmitted patients. So drag that measure into this point so that you can obtain the number of readmitted patients. So the number of readmitted patients is actually equivalent to 586. That is 1200 minus 614 will actually get you 586, or 586 plus 614 will basically get you 1200. So given that we already have the number of readmitted patients, I want us to actually do some analysis when it comes to the readmission analysis. So in this point, I want us to break down this number so that we can obtain the number of readmitted patients by age group, by diagnosis, and by department. Very simple. So what you have to do in that point is to hit on a matrix. After hitting on a matrix, we'll have something like this. So I'll actually bring it at the center. So we will drag the diagnosis into the rows, just like that. So the diagnosis into the rows. Then I want us to check on the distribution of these 586 across these different diagnoses. So we have to drag the number of readmitted patients into the values. Very simple, into the values like that. And that's it. So allow me to actually hit on the focus mode. So I want us to do the readmission analysis, that is the number of patients admitted based on the age group, based on the ethnicity, and also based on the gender. That one will actually be very helpful. So what you actually do is to hit on the matrix there. Then after clicking on the matrix, what you actually do is to drag the number of readmitted patients. So what you actually do is to drag the age group into the rows. After dragging the age group into the rows, we actually drag the number of readmitted patients into the values. So number of readmitted patients into the values like that, and this is it. So in this point here, you can actually check that for the adults, the number of readmitted patients were actually 292. For the children, the number of readmitted patients were actually 46. For the senior adults, they were 112. For the young adults, they were basically 106. And you can also obtain the percentages for this. And this one can also be done inside the visualization. So what you can actually do in this point is to just hit on the pie chart there, and it will actually be converted to a pie chart, and you can actually check that we have the percentages. So we have this one here. You can just hover your mouse there. This one here for the adults actually represents 49.83%. So a lot of adults are actually being readmitted in the hospital. So majority of the patients readmitted in the hospital are actually the adults, and the percentage actually stands at 49.83%. And the lowest number of persons being readmitted in the hospital are actually the children, with the percentage actually standing at 7.85%, and the total number is actually 46. On this point here, this one is actually for the seniors. The number of readmitted patients is actually 112, and the percentage is actually 19.11%. And finally, for the young adults, the number of readmitted patients is basically equivalent to 136, which basically represents 23.21%. So that's how you can actually obtain the percentages. So let's get back into the matrix there. So this is all. So if you add all these values, that is 292 plus 46 plus 112 plus 136 will actually get you 586. We can also break down that readmission based on the gender. So for the gender, what you have to do is to drag out the age group, then we actually drag in the gender. So drag in the gender like that, and you'll actually have it at 293. That actually means that we have 293 female patients being readmitted in the hospital, and the same 293 male patients being readmitted in the hospital. The total number is actually 586. And finally, we can actually check on the readmission based on the ethnicity. So remove the gender there, then you drag the ethnicity into the rows. So hit on the focus mode there. So in this point, we have the number of readmitted patients based on the ethnic groups. So the number of readmitted Kalenjin patients in the hospital is actually equivalent to 116. The number of readmitted Kampa patients in the hospital is actually equivalent to 104. The number of readmitted Kikuyu patients in the hospital is actually equivalent to 76. The number of readmitted Luya patients in the hospital is actually equivalent to 79. And the number of readmitted Luo patients in the hospital is equivalent to 94. And finally, the number of readmitted patients from the other ethnic groups in the hospital is basically equivalent to 117. So the total number actually sums up to 586. So basically, that's how you can actually do the readmission analysis. So we have actually checked on analyzing based on the age group, analyzing again based on the ethnicity, and also analyzing the readmission based on the gender. I would actually want to show you how we can obtain this kind of a dashboard. So remember, this is actually a responsive dashboard inside the Power BI. If I click on one of the items inside the pie chart, you can actually check that it's actually responding. Or if you actually click on one of the items inside the matrix, you can clearly check that it's actually responding. So how do we actually build this kind of a dashboard? Because you can actually check that this is actually a very beautiful dashboard. So let me actually show you step by step. So first of all, we are actually going to obtain the revenue by department. So we are going to use the line chart. So I'll actually come into the visualizations here, pick on this one here, which is actually the line chart. After I click on it like that, you can actually check that it will appear there. So you can actually enlarge it like that. Then you actually drag it to this part here. Then you can now drag the items into these fields here. So for the x-axis, we'll actually be having the departments. So we'll be having the departments on this part here. Then on the y-axis, we'll actually be having the cost, which is actually the revenue. So on the x-axis, we are having the departments on the x-axis like that. Then we actually get ourselves the cost into the y-axis, just like that. So we have revenue by departments, which is actually the sum of cost by department. That's it. Now, I would also want us to check on how we can obtain the average cost of treatment by diagnosis. So what that actually means is that we'll obtain the diagnosis or the list for the diseases. Then in every list, we'll obtain the average cost of treatment. So what we'll actually do, let's say for example, in the case of anemia, we'll actually do the addition for all the cost of treatments for anemia. Then we actually divide by the number of items, that is by the number of patients treated of anemia. So total cost, which is actually the sum of cost divided by the number of patients treated of that diagnosis, will actually get us the average cost of treatment by diagnosis. So that one is actually very simple, and we are actually going to use the bar chart. After clicking on the bar chart, I'll actually get it on this part here, which is actually okay. So allow me to actually use it down there. So in this point, I'll actually drop into the y-axis. So into the y-axis, we'll actually be having the diagnosis. Into the x-axis, we'll actually be having the average of cost. So y-axis, we have the diagnosis into the y-axis like that. Then into the x-axis, we are basically having the average of cost. So drag the cost into the x-axis like that. Then you change that sum to be the average cost of treatment. So this sum of treatment actually means that we have obtained the total sum of treatment for the diagnosis. But in our case, we actually do not want the total sum of treatment for the diagnosis. We actually want the average cost of treatment by diagnosis. So I'll actually click on this average here, and that's all. So basically we have the average of cost by diagnosis. Very simple. So in this point too, I would actually want us to obtain the count of diagnosis by diagnosis and age group. That is, I want us to see the number of patients that have actually been treated by age group. So the count of diagnosis by diagnosis and age group, that is count of patient by age group when it comes to different diagnoses. I want us to see the distribution of these diseases across the age groups. So when it comes to distribution of these diseases across the age groups, what we'll actually do is to have a count of diagnosis by diagnosis and age group. Let's actually see that. So we'll actually be using a stacked column chart. So what you actually do in this point is to hit on the stacked column chart like that. Then we actually drag it to the bottom right like that. So what we actually have to do on the x-axis is to drag the diagnosis. So we basically drag the diagnosis into the x-axis. Then we also drag the count of diagnosis into the y-axis. Just like that, and we are basically obtaining the count of diagnosis. So allow me to actually explain this for you. I'll hit on the focus mode there. So basically, this is actually telling me that when it comes to the disease anemia, the number of patients in the hospital is actually equivalent to something like 113. When it comes to appendicitis, the number of patients is also equivalent to 113. When it comes to arthritis, the number of patients is actually equivalent to 108. When it comes to hypertension, it's actually equivalent to 107, and so forth. So this is basically the count of diagnosis by diagnosis. That is the count of all the patients who have actually been treated of anemia, the count of all the patients who have actually been treated of appendicitis, the count of patients who have actually been treated of arthritis, the count of all the patients who have actually been treated of hypertension, just like that. Now, what if you would actually want to break down this column in terms of age group so that you can actually see how long the column for the adults will be? How about the seniors, the young adults, and the children? How is that even possible? We have to drag the age group into the legend. So scroll down to where we have the patient and drag the age group into the legend. Just like that, and now you can actually check the breakdown. So in this point here, you can actually check that for anemia, this is actually the group adult. And out of 113 persons that we actually had when it comes to anemia, 51 of them are actually adults. On this point, 12 of them are actually the children. On this part here, 27 of them are actually the seniors. And finally, 23 of them are actually the young adults. So you can actually check that when it comes to anemia, the patients dominating are actually the adults. So basically, that's how you can actually do the analysis here. Up here, we can actually get a matrix. So when it comes to outcomes by diagnosis, allow me to actually use a matrix because that one is actually very simple. So click on a matrix there, then drag it up there. Into the rows, we'll actually be having the diagnosis. That is, we'll be having the diseases arranged vertically like that. Then along the columns there, we'll actually be having the outcomes. That is, discharged. Then we actually see the count of discharged. We'll also be seeing the transferred. We'll also be seeing the ones who actually improved and so forth. So drag the diagnosis into the rows like that. Then basically we have to drag the outcomes into the columns. So drag the outcomes into the columns. Outcomes is also inside the admissions table. So outcomes into the columns, just like that. Now you can actually check that it's actually arranged well. We have the outcomes arranged in the columns and we have the diagnosis along the rows. So in this part here for anemia, we want to obtain the number of deceased persons who are actually suffering from anemia, the number of deceased patients who are actually discharged and were suffering from anemia, the number of anemia patients who actually improved, and the number of anemia patients who are actually transferred. That actually means that we have to obtain the count of outcomes. So to obtain the count of outcomes, we have to drag the outcomes into the values like that. Then after dragging the outcomes into the values, we change it into count of outcomes, just like that. We add 4 deceased patients who are actually suffering from anemia. We add 83 patients discharged who are actually suffering from anemia. We add 16 anemia patients who actually improved, and we add 10 anemia patients who are actually transferred. So the total number of anemia patients that we add in the hospital is actually equivalent to 113. Now in this part, we can also use a pie chart to obtain the patient attendance by age group. So what you have to do is to click on the pie chart like that. So this is basically a pie chart and we are supposed to obtain the patient attendance by age group. So I'll actually drag it up there. Each one of them should be actually having adequate space. So patient attendance by age group. Allow me to still resize it like that, which is actually okay. Then on this part here, it should also be on level. Yes, that's it. So patient attendance by age group. Patient attendance is actually based on the admission ID, because if a patient comes to the hospital today, they will actually be given an admission ID, which is actually a unique one. Then when a different patient actually comes again, they will be given the admission ID. So we would actually want to have the count of these admission IDs by age group. So out of the patients who actually came to the hospital, how many of them were actually adults? How many of them were actually the senior adults? How many of them were the young adults, and how many of them were actually the children? So the breakdown of patient attendance by age group. So what you have to do is to drag the age group into the legend. So scroll down there to where we have the patients table, drag the age group into the legend like that. Then we have to drag the count of admission ID. So the count of admission ID, which is actually the ID. So we are dragging the ID into the values. Then we actually changes to count of admission ID. So that's it. Now you can actually check that in this part here, we have 48.06% of them. Allow me to actually hit on the focus mode so that you can check on that clearly. You can check that this is a pie chart and this is actually the breakdown of patients attendance by age group. So you can clearly check that for the adults. I'll click on it like that. We have 577 adults, which actually represents 48.08%. It's actually the largest, as you can see. I can also click on the young adults there and you can actually check that it's actually 24.42%, which is actually 293 patients. I can also click on the senior adults there and you can actually check that we had 230 senior adults representing 19.17%. And for the children, I'll also click on it like that and you can clearly check that we have 8.33% and the total number of child patients was actually equivalent to 100, just like that. So you can always hover your mouse like that so that you can always check on the legend without actually coming to this point here to identify the blue one actually belongs to the adult. Just hover your mouse there and you'll actually see that age group is adult. On this part here, age group is child, age group is senior, age group is young adult. So that's all. Now, given that we already have the sum of revenue by department, we also have the cost of treating every disease. That's the average of cost by diagnosis. We also have the breakdown of patient attendance by age group, and we have the count of outcomes by diagnosis. So we have the diagnosis here and the count of outcomes. And on this point here, we have the breakdown of the total number of patients suffering from different diseases by age group. That is, we have actually broken down the number of patients suffering from different diseases by age group. That is, in this point here for anemia, we actually had 113 patients suffering from anemia. But we have also broken down that 113 based on the age group. That is, the breakdown of patients suffering from each diagnosis by age group. breaking down the total number of patients suffering from each diagnosis by age group. That's it. That is the count of diagnosis by diagnosis and age group. Now in this part here, I would actually want us to come up with the insights. So allow me to actually use a text box there. So I'll actually click on a text box, and this is it. So I'll actually try to drag it like that. Yes, that's okay. And on this part, drag again. On this part too, yeah, like that. And that's all. Now I want us to come up with the deep insights, which will actually make every person who actually interacts with this dashboard to understand this data quickly. The title will actually be Quick Insights, just like that. And we'll actually start by saying that another space, the first one there, we'll actually go to the first one there. So the first one here, you can actually check that this is actually the sum of revenue by department. So you can clearly check that the department with the highest sum of revenue is actually orthopedics. So orthopedics is actually the department with the highest sum of revenue, and the sum of revenue is actually equivalent to 8.38 million. That's actually approximately 8.38 million. So we can actually come up with that insight here. That is, the department with the highest sum of revenue is orthopedics, with a sum revenue of 8.38 million. Just like that. Go to the second item. So we can also come to this point here, which is the average of cost by diagnosis, which is actually the average of cost of treatment by diagnosis. So which disease is actually the most expensive to treat? So clearly we can check that the disease which is actually the most expensive to treat is actually fracture, and the average of cost of treatment is actually 134.43, which is approximately 51k. The most expensive disease to treat is fracture, with the average cost of treatment at 51k. Just like that. We go to the next item. In this point too, we can actually check that in this part here, majority of the patients are actually adults. How? Because when you come to anemia, you can actually check that the largest column actually belongs to the adults. They are actually 51. When it comes to appendicitis, the largest column is actually for the adults too, and it's actually 60. When it comes to arthritis, the largest column is actually 55. Out of all these four columns, the largest one is actually of 55, and it's actually for the adults. When it comes to hypertension, the largest column is actually for the adults, and it's actually for 6 adults. When it comes to heart failure, the largest column is actually for the adults again. We have 51 adults. When it comes to diabetes mellitus, the largest column actually belongs to the adults, and it actually stands at 51 adults. When it comes to COVID-19, the largest column out of these four actually belongs to the adults, and it actually stands at 53. When it comes to UTI, the largest column out of all these four belongs to the adults, and it stands at 54. When it comes to pneumonia, the largest column out of all these four belongs to the adults, and it stands at 43 patients. When it comes to gastritis, the largest column out of all these four belongs to the adults, and we have 39 patient adults. When it comes to fracture, the largest column is actually for the adults, and we have 36 patients there. When it comes to malaria, finally, the largest column also belongs to the adults. Yes, the largest out of all these four belongs to the adults, and we basically have 38 malaria patients who are actually the adults. So that's it. So we can actually say that majority of the patients in this hospital are actually the adults. So that's actually another important item. So majority of the patients in the hospital are adults. Just like that. Let's also go into the next item. So in this part here, we can also come up with an insight. So when it comes to the deceased persons, majority of the deceased persons in the hospital are the ones suffering from COVID-19, and the number actually stands at 5. That's also an important item. So most of the deceased persons in the hospital are the ones suffering from COVID-19. They are basically they are 5, just like that. And now we can actually generate the last insight up there using the count of admission ID by age group. This is actually the count of patient attendance by age group. So clearly you can check that majority of the patients in the hospital are actually the adults, and we have 577 of them, and it actually represents 48.08%. That's what we actually made up in this point here. We had not actually included the figures, so the figures is actually 577 patients, and the percentage is actually 48.08%. So that's it. So in this part, we can actually add that there are 577 adult patients representing 48.08% of total. Just like that. So majority of the patients in the hospital are adults. There are 577 adult patients representing 48.08% of the total. Just like that, and it's actually done. Now we can also come up with one of the insights, which is actually very important. So we actually said that in this point, we were basically breaking down the total number of patients by age groups. So we have the total number of patients suffering from different diseases. Then we actually broke down that number by the age groups. So we actually add 4 age groups in our case. We add the adults, the children, the seniors, the young adults. So that's why each column has actually been broken down into 4. So if you actually need for the adults alone, you can just click on the adult. Click on the adult alone. Now you can actually check that it's actually blue everywhere, and it also responded everywhere in our visual. Click for the children alone, and you can actually check that our dashboard is actually responding, and you have the deep blue ones here. Click for the seniors, and you will actually have the orange ones everywhere. Click for the young adult, and you will also have this kind of a color activated. So basically that's it. But because you are basically breaking down the total number of patients based on the diseases and the age groups, then we can as well say that this column is actually the largest, and this one also is actually the largest. So I can just say that majority of the patients in this hospital are suffering from anemia and appendicitis. Why? Because we have the longest columns there, which is actually representing the total number of patients. Remember, each column actually represents the total number of patients. It's only that we have actually broken down the total number of patients based on the age group. Otherwise, the column itself, which is actually the long one here, represents the total number of patients. So I will actually click on this like that, then come to this point, hit on the focus mode. Then I can just drag out the age group so that we can actually identify the number. In this part here, you can check that the number is actually 113. The number in this point is also 113. Without the age group, it is basically meaning that we have the total number of persons suffering from different diseases. Yes, just like that. So these ones are the total number of persons suffering from different diseases. For anemia, we have 113. For appendicitis, we also have 113. So if you would like to break down that number based on the different age groups, then you just have to drag the age group into the legend. So that's why we were basically dragging the age group into the legend. But you have already seen that the total number of patients suffering from anemia is 113, and also the total number of patients suffering from appendicitis is 113. So clearly we can come up with a conclusion that the diagnosis with the highest number of patients are anemia and appendicitis. The number stands at 113 for each. Just like that, and it's actually done. So what I can do is to collapse for visualization and also collapse for the data. That's all. Isn't this what we actually had? Yes, this is basically what we had, and you can clearly see how beautiful this is. Yes, so this is basically a line chart. This is basically a pie chart. This is a matrix. This is a bar chart. and this is a stacked column chart. This is also our region for the quick insights. So remember, you can also add the font if they are not actually very clear. You can just select all of them like that. Then we just hit on 10.5. 10.5 I think will be better. Then in this point here, we can just select quick insights. Select quick insights. Then we just bold. We can have it at the center. You can remove this A for anemia there. That's it. So click outside. Fine. Yeah, that's all. So this is basically a responsive dashboard that you have made by using the Power BI. That's all for this project. So you can as well remove the quick insights if you would actually want to insert something else. Let's say, for example, you do not actually want to see the quick insights. Then you can insert a visualization, which is, let's say, for example, we would like to identify the months where we have the least patient admission. So where the patient admission is actually very low. So to identify such kinds of months from our data, it will be very possible. So I want us to use a line chart. So what you will actually do, allow me to actually drag this one. I can bring this one here like that, drag this one there like that. Then on this part, I bring this one here. Then we have that small space there remaining. Then we can have a line chart here. So basically, I'll click on the line chart like that. Inside the line chart, we'll basically drag the admission date into the x-axis. Then into the y-axis, we'll actually drag the count of admission ID. That's into the y-axis, count of admission ID, just like that. So in this part, what we have to do is to remove the day, because we are not actually interested with the day. We are just interested with the months and the year. So you can remove the day like that, so that we can actually compare the months in the two different years, 2024 and 2025. So we are not also interested in the quarters. So in this part here, you can actually check that we have January when it comes to 2024, and we basically have the same January when it also comes to 2025. And you can actually check the count of admission to be 56 in 2025 January, but when it comes to 2024 January, you can check the count to be that 6. I want us to identify the months with the lowest admission. So we can actually identify that we have July of 2024. We can just consider July of 2025. July of 2025 as a count of 48, while the July of 2024, yes, as a count of 33. So 33 plus 48 is actually 81. So for July, it's actually 81. But we also have this one down here. You can check that we have February. It's actually 41. So February for 2025 is actually 41. I want us to check on February for 2024. So February 2024 is actually 43. So 43 plus 41 is actually 84. So basically we can conclude that July here add a count of 33, and July on this other end also add a count, and July on the other end also add a count of 48. We can make a conclusion that July has the lowest admission, standing at 81, followed by February, which actually stands at 84. Now allow me to actually collapse this and also collapse this so that we can have a clear picture of this. So you can actually check that it's something good. Some space like that. Then this one, I also drag it there. Then this one here, I just have to increase the size just like that. So if this one is your preferred one, because you do not have the insights here, you can actually pick on it. But I would prefer having the one with the insights, because you will actually get the summary of your visual. It's not just about checking your visuals. No, you will also have a summary. So basically you can convert this one here into an area chart so that you can just have one line chart. So you click on it like that, come to this point here for the visualizations, then you just have to click on the area chart, click on it like that, and then now our visual is so perfect. Collapse the visualizations and also collapse the data there, and that's all. So in this point, I would also want to show you how we can insert the cards so that they will be our KPIs. That is obtaining the total number of patients that were actually admitted. I have another card to obtain the total number of readmitted patients, because in those admissions, some patients were actually readmitted. So we would actually want to check the number of patients who are readmitted. Then we also check on the average length of stay and the total revenue. So what I'm actually going to do in this point is to click on the first one there. Then I actually try to reduce the size, because we will be having the cards up there. So just like that, that one is actually okay. On this part too, we'll actually try to reduce so that we can have a space up there for the cards. So we can just increase this a bit. Yeah, just like that. On this case too, I'll click on it like that, then drag it down so that it can level up there. So when you actually see that red line, it actually means it's on level. Now, in this point, allow me to actually start with the total number of admissions. So I'll click inside the visualizations there so that we can expand, and also click inside the data. So for the total number of admissions, what you are going to do is to click on a card. After clicking on a card, you will actually get something like this. So allow me to resize it, then reduce again the length. Then I can have it up there so that I can be seeing the adjustment. So something like that. It's still very small, but I want us to drag the admission ID into the field so that we can basically see what we'll have there. So the count of admission ID. So you can actually check that the total number of admissions in the hospital is basically equivalent to 1200. So 1200 is the total number of admissions in the hospital, and that admissions actually include the number of patients who were readmitted. Have that in your mind. So let's also do a card for the average length of stay. So for the average length of stay, what you are going to do is to hit on a card. Then after hitting on a card, we'll actually get this kind of a card. Instead of us actually resizing it again, we can just remove this. Then we just click on the existing card there so that we can hit on Ctrl+C to copy, Ctrl+V to paste. Just like that. And now come to this point here. You just have to click on it. Then you come to this point here. We want the average length of stay. So this is basically the length of stay. This is actually a column that we had actually created so that it can obtain us the length of stay, which is actually the discharge date minus the admission date. So we are going to drag the length of stay into the field, just like that. And now we'll actually get the sum of length of stay. But in our case, we actually wanted the average of length of stay. So it will be something like 5.01 days. I would also want us to check on the total revenue. So for the total revenue, we have to click on one of the cards again, Ctrl+C to copy, Ctrl+V to paste. Just like that, drag it on this part here, and that's okay. So in this case, we'll actually click on that card. Then we come to this point here. We just have to remove the average length of stay. Then we drag in the cost, which is actually the sum total of revenue. So the sum total of revenue is basically equivalent to 54 million. Now in this point, I want us to check on the total number of readmitted patients. Remember, we had actually checked on the readmission analysis. That is the total number of patients readmitted, and also the total number of patients readmitted by age group, by diagnosis, and by department. So make sure you actually check on the readmission analysis that we actually did before. So in this point, we'll actually use a card. So click on a card there, but instead of actually clicking on a card, allow me to actually copy what we actually have up there. So click on one of the cards there, Ctrl+C to copy, Ctrl+V to paste, just like that, and drag one of them to the right. So in that point, we won't actually be having the sum of cost. It will be the number of readmitted patients. So we have the count of admission ID, which is actually the number of admissions in the hospital. So this number of admissions also include the number of patients who were readmitted. Then in this point here, the average length of stay for all the patients admitted, the sum total of revenue. Then in this part, we have the number of readmitted patients. So what actually remains in this point is for us maybe to include the name of the hospital, which is actually Top Care Hospital. So it will be Top Care Hospital dashboard. Then we can actually see how we can also play around with the background. So allow me to actually collapse that and also collapse this. Then in this point here, we'll also try to reduce this so that it can match with what we have there. So that's it. Now we can drag all this to the right. So drag all of them to the right like that. This one again to the right, and this one basically to the right. So what remains in my case is to add the hospital name, then we include dashboard. So how do we actually do that? Get yourself into the home tab there, then insert group, we have what you call the text box. Click on the text box like that. So we just have to reduce this like that so that we can have this note on the right, because when it's actually below, you can't actually reduce the text box. Now you can actually check that we can't actually drag it up. So we have to reduce, make it thin like that so that it can actually get to the right. Then on this part here, we have to reduce again up there. Then on this point, we increase the size to the right. So drag it to the right like that. And on this part, drop it there. So in this case, we'll now have the title of the hospital, and we include the name dashboard. That is Top Care Hospital dashboard, just like that. and it's actually done. So select everything there, hit bold, then on this font size here, you can just pick on 11. We can get to before T there, then hit on enter so that you can have a space above it. So we have Top Care Hospital dashboard. So click outside Top Care Hospital dashboard, the total number of admissions, the average length of stay, the sum of revenue or the sum of cost, the total number of readmitted patients. That's all. We had actually checked on the insights here. So what you can actually do again in this point is to play with the background colors, which is actually very possible. So if you would like the blue color to be actually at the back, then you can just hit on insert. Then what you can actually do in this point is to hit on view. Then inside view, we have what you call the themes. Then hit on the down arrow there. Come to this point. Then we hit on customize current theme. Then page. Then I'm actually interested with the background color. Then we can actually say blue. There's no problem. Then you just adjust the transparency. We can have it at 50. So page background is actually blue. Then transparency is actually 50%. So the moment I hit on apply, then you will actually see what happens. So you can actually check that we have the blue color there at the back. You also have the blue color there. So we can now introduce a very thin coloring there to actually show us that there's a separation between these cards. So I'll actually click on the first one. Then I just drag it to the right like that. Just add more space there to actually show us the background color. And in showing us the background color, it will be showing us that this one is a different card from this one here. So to this card again, we have to drag to the right like that. And to this card again, we just have to drag again to the right, and to this card again, just drag it to the right, just like that. Now I think that's all. So you can also drag this one here a little to the right, and I think this is now very perfect. So in this point, you can check that these ones are different cards, and this one is actually a text box. So a text box, a card, a card, a card, and a card. So this is perfect. That's it. Thanks.